Hi, my name's Justine Davis. I am a registered nurse and I'm a cosmetic injector here for Rejuvenation Station. I want to introduce myself to you, tell you a little bit about myself, and make you acquainted with our services. I have been an injector for over 10 years. I started as a surgical nurse. I am experienced with botulinum toxins, which you would recognize the name brand Botox. There are other venues of botulinum toxin, which are Dysport and Xeomin. People are aware of those. We're very fond of Botox as our product in that it is FDA approved. It's the most recognized brand on the market. We also offer dermal fillers through Rejuvenation Station. We use Juvederm products, which are also an Allergan name brand product. Dermal fillers and Botox can enhance facial beauty in so many ways as anti-aging processes, and also important for people that just want a slow aging process or augment areas, augmenting the chin, augmenting the zygomatic area, the lateral cheeks, highlighting a young face, or rejuvenating an aging face. First and foremost, patients do ask, what is Botox? Great question. I love to speak to it. Botox is simply, it is a toxin, which is scary to people. However, it breaks down into a purified protein. Every time you're using a muscle in your face, frowning, squinting, you're causing creasing of the face, and that's where we get lines. Botox in cosmetic form is used to soften the muscle, only allowing the muscle to contract to a certain degree. If you think about folding a piece of paper in the same crease every day, creasing it, if you would add Botox to that crease, it will only allow it to fold so far. Botox can be titrated for units. Some patients like to have no movement. Some patients want to look very natural and have some movement. You do not have to be completely frozen with a Botox treatment. Patients do ask, what is the difference between Botox, Xeomin, and Dysport? My answer is very little. However, Botox Cosmetic, which is branded by the company Allergan, is the most reputable of the three names. They are all botulinum toxins. They are chemically balanced in different ways. However, they're all meant to slow muscle contracture. In general, Botox is used from the nose and above the face. Experienced injectors will use Botox in the lower face, and I do use Botox in the lower face as well. Botox can be used in the frown lines. Often as we age, this muscle shortens. You can use Botox around the mouth to give you a horizontal, your mouth really should be horizontal when you're at rest, not frowning when you're at rest. Botox can be used to fix that. It can also be used for the lines around the mouth. People say, I have smoker's lines and I never smoked. Botox can soften the creasing around the mouth that is causing muscle contracture that makes what we often refer to as smoker's lines. Also in the crow's feet, that's the lines around the eyes when you're squinting, smiling, from constant movement of the muscles around the orbital rim. Botox slows that. It also very often used in the glabella area, which are muscles that work together when you're thinking, frowning. People will say, I have a number 11 here, I have a number 1. That's from the glabella muscles working together, creasing every day, causing muscle contracture. Frontalis muscles, which are vertical muscles in your forehead. Every time you raise your eyebrows, you're creating horizontal lines, and Botox is used there as well. I'll also mention that Botox can be used in the cords in the neck. When you clench your teeth, you'll see muscle cords in the neck. Beautiful product for softening those muscle bands. Patients do ask, how often do I need to get Botox for best results? Botox will wear off or be less effective at the 3-month mark. At 4 months, it is totally worn off. You will regain the muscle contracture that you had. If you don't like Botox, then you know you're going to go back to baseline. That being said, Botox used faithfully. Patients that have been doing faithful Botox 3 and 4 times a year, they're using those muscles less frequently. Over time, their lines are always going to look better. Perhaps if they even did Botox for a year or so and then gave it up, their lines will always look better than perhaps their twin who never treated lines from muscle contracture. So to keep that answer simple, Botox will be worn off in 4 months. My recommendation is to have it retreated, have your a Botox treatment every 3 to 4 months. Again, over time, you will see what I'd call permanent improvement, where your lines will always be better have you been using Botox for some amount of time. Patients do ask me, how old should I be when I start using Botox? That's a great question, and it's a personal question. I would say that when you start to see lines in your face that are bothering you, it's time to think about it. Good time for a consultation. Get in touch with me. We will look at what's bothering you and make a recommendation based on your particular needs. I have patients as young as in their 20s and as old as in their 80s. So there's really no real answer for that. It's when you're ready. Patients do ask, are Botox injections painful? They can be, but depending on how the injection is delivered, and I pride myself in careful injections. I take my time. I apply ice if necessary. I also am happy to put on topical anesthetic, which would be a benzocaine, tetracaine, lidocaine topical cream. That helps a bit. However, I find that my patients do not complain about pain. And I'm very proud of the fact that I insist on having ample time with my patients, and I do take my time. Common question that I hear is how many Botox treatments are needed before you see results? I'll take that question first, which is individual. The answer is it depends on where we're starting. If you have deep lines, if you have sun damage that's been there for years, we may have to see you Botox treatments for a year before you really start to see softening of deep lines. If you start when you're just starting to see the creasing and you keep faithful Botox going, you'll be seeing results after the first treatment. Patients do ask about healing after a Botox treatment and what is the aftercare. Healing from a Botox treatment should be very minimal. There's always the possibility of a bruise. Anytime you are inflicted with a needle to your face or an injury to your face, even a needle that doesn't contain Botox holds the potential of a bruise. However, it can be avoided by careful injections, by holding pressure on each injection site right after it's injected. Ice is always helpful, and avoiding products such as ibuprofen, fish oil, flax, prior to injection, perhaps 24 hours prior to injection and 24 hours after. That can also reduce the chance of bruising. Bruising is the first thing that comes to mind when patients say, what is the risk of Botox? I want to say there's always a risk of a bruise. However, it will be minimal. Patients do ask, what is the aftercare from a Botox injection? My advice is to keep your head elevated, at least for the next 24 hours. I would say avoid cardiac activity. I would also like you to avoid yoga for the next day. All that making sense that when your head is down below the level of your heart, it can increase the chance of a bruise. However, getting back to your normal life the minute you step out of here is what I recommend. Patients often ask about their lips. That's a big concern as we age. The lips become thinner, and lip with some volume is youthful. I want to address Botox is not a volumizing product for the lip. However, Botox can be used around the lips to soften lines. It can be used above the lip. A patient that has what we call a gummy smile, when they smile and you see much of their gums, that can be addressed with Botox and softening the upper lip. Thank you for your time and interest in Rejuvenation Station. I look forward to meeting with you, providing a careful evaluation, and addressing your concerns.